You are watching the Doc Talk Show.
Sickle cell can be a problematic disease and very challenging, especially for parents to be able to recognize that their child might be having the disease. So how exactly can we tell the two? Let's ask our expert in the studio, senior hematologist. The hematologist, by the way, is a doctor who specializes in blood diseases, of which sickle cell happens to be one of those diseases, because it's a disease which attacks the hemoglobin. That's the pigment that gives blood the red color, and therefore it's this field of expertise. So Dr. Kasiri,
yes,
how can a parent know that their child might be having sickle cell?
Thank you very much. So ordinarily we begin with what we call a history. Usually the parents, either both or one, has ever heard about the sickle cell disease, or has ever had a relative with sickle cell disease in their family.
Okay. Like
And
there'll be
so
a family
history of sickle cell disease somewhere.
Okay.
That should raise the need to look out for whether this child has sickle cell or not. So we start from that point.
But are there families where it's not even there?
Perfect.
Yes.
The other scenario is what happens in majority of the cases where you've never heard about anyone in your lineage having sickle cell, and then you are faced with a challenge in your child for the first time. And how would you know in such a case?
Yes.
So when children are born, and as they approach around the 6 months of age, there are changes in their hemoglobin from the one that they had when they are in the womb to the one they should have outside the womb when they are born.
Okay.
So the one they have is called fetal hemoglobin, and outside they tend to have the normal hemoglobin. So as they approach the month of 6 months, that's when the signs usually first manifest. They may present with either episodes of anemia, meaning that they have a low blood level of hemoglobin.
Okay.
And so when you go to this facility, the doctor or clinician tells you, it seems your child has
low blood.
Low
has
blood.
little blood.
Yes. So one of the things you should think about at that moment is what could be causing it. Could it be sickle cell amongst other things?
Okay.
But then the other major presentation is that usually children present with swelling of the hands and the feet without any incident of injury. And what some parents may think is that probably the helpers at home, the house helps, could have maybe hurt these children while they are away. Okay.
Or beating the satrap.
Yes, or the child could have
house girls, eh?
Perfect.
But so the hands and the legs are swollen. Is it the hands, or I think they used to tell us it's the joints?
The hands.
Basically the hands.
Yeah, the hands, fingers, and the feet and toes.
Why is it the hands and not anywhere else?
Okay, the hands and the feet have small vessels. They are called end arteries. And sickle cell, by the way, presents with blockage of the small vessels due to this abnormal hemoglobin in the red blood cells under certain conditions. So when you have a blockage occurring where you have the end vessels, the ends of the vessels, you will have changes, pain and swelling will happen.
Very interesting. So painful swelling of the hands and legs are some of the features, in addition to having little blood.
Perfect. The other features include, like Madam Tracy has mentioned, they may present with yellow eyes, which we call jaundice. They may present with stunting or growth challenges. When they are thin or they are not growing, normally according to the age, they are not catching up with the age-appropriate growth.
Oh, okay.
Yeah, and then the different pains in the different parts of the body, which is the hallmark of the disease.
The pains.
Yes, pains,
Okay.
without any injury. And later on we shall understand what really
Happened.
What really happens.
happens.
So if I can summarize, you're saying these, the red cells which are sick begin to block, they may affect the small vessels.
Yes.
So the small vessels are usually at the end, maybe like in the hands, the legs. It cannot be in any other organ. It's just that they are very small and you can't see them. But commonly in children, you would see swollen legs or very painful, legs, hands and feet. Sometimes I think too, affects the knee. It can literally affect any organ. Right?
But specifically,
Specifically.
it's called the
Specifically,
hand and foot
and
syndrome,
foot syndrome.
because it usually has a predilection, it goes for the hands and the feet
Okay, so those
as
are
the first symptom.
So those are some of the signs to help you identify that possibly your child could be having sickle cell disease. The next question is, so what does a parent do, Madam Tracy? If they call you, they're like, I think my child has, or they're watching the show and they said swollen legs, swollen feet, my child has it. What do you tell them?
I immediately tell you, do not conclude that they have sickle cells.
Okay.
You have to first go and test. Go test the child, because some diseases have the same symptoms and signs. So before you conclude, you don't parents know how to self-diagnose. Okay, now I heard of folic acid on TV. I heard of hydrox. They start, coming up with their own kind of treatment. But before you start anything, if you think this child has this, please go to the doctor. Come to our office, BMK House Hotel Africana. We will take a sickle test. But still, I will recommend to go and do an electrophoresis test. It is that.
Are those the types of tests
Yes,
to diagnose?
yeah.
Okay.
This is a sickle test. It's just a field test.
It's
I
like
test
a
and
screening
yes,
test.
thank you.
Okay.
And then if I find that you have traces of sickle cell, I'll tell you to go and do a confirmatory test that is done in hospitals, big hospitals, Molago. Like now, Lancet here does. I think it does this test as well.
I think most of the hospitals.
Now I think
do them.
So, yeah.
Yes.
So I tell you immediately, go see a doctor. You come with the results. Then we talk about sickle cell, so that you understand what sickle cell is. Because most times this will just give you results, and they might not really give you a lot of time to explain this. Now that is where I come in. After you've come with your results, we sit down and start understanding sickle cell anemia.
Sickle cell. So step one,
Yes.
recognize the signs.
Thank you.
Which are the poor growth, the pains in the arms, the legs, the yellow eyes, little blood. Step two, seek help and get a test done. You said the first step is the sickling
It
test.
might be a sickling test, but
Sickling test, the screening test.
Yeah, screening test. But if you come to my office direct, well, of course I'll give you a screening test so that the parents and daddy, mommy know that, okay, I'm a carrier, because most of them, they even do not know that they are carriers.
You also test the parents.
Oh, I test the whole family.
The whole family.
The whole family. But for this sick child in particular who has the signs and symptoms, I would recommend to go and do a confirmatory
test.
Yeah,
and then we'll look for Dr. Kasiri.
Oh, of course, they always do.
Yes.
Yes, there is no other doctors.
All right.
Yeah.
So this is just part one of this series of this interview. We are discussing sickle cell. You can see it's quite a big disease, and there's a lot we haven't yet covered. We've just reached the step of when your child is finally diagnosed with sickle cell. We say it is when you have a positive. Is it interpreted as positive, doctor? The HB electrophoresis test. What does it look like?
Yeah, it would come out as a positive test in the case of
test.
sickle cell.
But in this sense, it's measuring those genes, I think the gene components in the hemoglobin. So when it says it is AA, that is the double A, indicating the two genes, the genetic parts of the hemoglobin, that is a normal test.
Yes.
So that means
You're normal.
That's
Yes.
that means you do not have sickle cell.
Yes.
perfect.
If it comes as SS, and you said SS is
This is
Double.
sickle cell.
the double
double.
abnormal gene,
Yes.
and that means you have sickle cell.
Perfect.
Disease or anemia.
Sickle cell disease,
Yeah.
the real disease.
Uh-huh.
Okay. And if you have AS, because you can have a combination of half the normal, half the abnormal,
Yes.
that equals the
trait
carrier.
or carrier.
Perfect.
All right.
You are watching the Doc Talk Show.